Ever since Republican presidential candidate Mitt Romney picked Wisconsin Congressman Paul Ryan as his running mate, it's been the congressman's budget that has become a major issue in the upcoming election, primarily Medicare. Carl Cameron takes a closer look.
So now that you've been out for a full whole week, are you experienced enough to step into the Oval in the case Mr. Romney can't finish the job?
Mitt Romney would not have selected me to be his running mate if that wasn't the case. I would not have accepted his invitation to join the ticket if that was not the case.
Mitt Romney's vice presidential running mate visited the Villages retirement community in the crucial battleground state of Florida with his 78-year-old mother Betty Douglas in tow, where he accused the Obama administration of raiding Medicare for $716 billion to finance Obamacare.
Medicare was there for our family, for my grandma when we needed it then, and Medicare is there for my mom while she needs it now, and we have to keep that guarantee.
Ryan and Romney would keep Medicare in place for seniors and those soon to retire, but would offer young people a choice of a fee-for-service or voucher plan. President Obama, during a pair of stops in New Hampshire, complained that the GOP would end up costing seniors more for fewer services.
My plan saves money in Medicare by cracking down on fraud and waste and insurance company subsidies. And their plan makes seniors pay more so they can give another tax cut to millionaires and billionaires.
It was the president's third visit to the Granite State this year. He also focused on taxes.
They have been trying to sell this trickle-down snake oil before. It did not work then. It will not work now. It's not a plan to create jobs. It will not reduce the deficit. It will not move the economy forward. It's the wrong direction for America.
So what impact could Ryan's plan have here in the Garden State when it comes to government-funded health? Joining me now to break it all down is Dr. Alita Eck, who is the president of the Association for American Physicians and Surgeons, and Jeff Brown, policy and communications coordinator for New Jersey Citizen Action. Welcome to the show. As part of Ryan's budget plan, future retirees would actually be encouraged to consider private coverage that the government would help pay for in sort of a voucher-like system. What's your reaction to that?
Well, that's exactly right. My reaction to that is that the Romney-Ryan plan it's a radical solution to a problem that where common sense solutions exist, and it's really taking a program like Medicare, where you have guaranteed care for our seniors, and turning into a private voucher coupon system where seniors are just given a coupon to take to an insurance company, and really where they're left on the hook, having to pay a large portion of their costs. The Center on Budget and Policy Priorities estimates that seniors could pay as much as $6,400 out of pocket a year under the Ryan plan.
What do you think about that?
We have to understand that since 1965, when we started Medicare, it was set up as a system when people didn't live much further than 65 years old, and that was kind of the way they picked that age. So people are living a lot longer. We've got the baby boomers coming in. And because of all the different things that we now can do in medicine, every senior is expected to spend $100,000 more than is taken in by the Medicare premiums and the taxpayers. So it's huge, and it's unsustainable.
So does that mean people who get sick, what happens to them?
Well, now they're getting cared for, and the Medicare system is just continuing the way it is. What Ryan has done, he's tried to think of ways to rein it in, and not by big government top-down price controls, which just winds up causing shortages. Instead, by having the people care what things cost, and that's the idea. By 2023, his idea would be to allow people who are getting to Medicare age to either accept traditional Medicare or buy insurance that would help ratchet down the cost, and then the government would subsidize a fixed amount every year instead of just all you can eat.
Is the system sustainable as it is?
Well, we certainly need to strengthen the system to ensure it's there for future generations. And the President Obama, with the Affordable Care Act, or affectionately known as Obamacare, does that in a couple ways. It cuts waste, fraud, and abuse by about $718 billion. Part of that comes from cutting payments to insurance companies that were overcharging the government. Another part of that is by optimizing the way we pay hospitals in a way that the hospitals agreed to. But I think that the key issue here is that, you know, Medicare it's a vital program that helps millions and millions of seniors every year. It's been doing so for the past half century. It's really, you know, I think one of the greatest public policy achievements in the history of this country. It's one of the things that shows just how great this country is. And to try and solve the Medicare problem by just outright ending it, which the Romney-Ryan plan would do, it would privatize it, it would break the budget, and it would end it. By trying to fix it by ending it, I just think that it's a misguided solution. I think that there are very common sense solutions to make it sustainable and ensure that it's there for future generations.
And the president's plan apparently wants to also make sure that it's there and wants the savings to also be there. Why do you think that won't work?
He is proposing to take $716 million out of the Medicare system and bring it into, give it to Obamacare, to pay for Obamacare. Or is it $716 billion?
Billion.
Much more. And he's saying he can do this by eliminating fraud and abuse. Well, if they could have eliminated fraud and abuse in the Medicare system the way it currently is, they would have done it. It's just not that easy. And when you have top-down control, and you have all those billions of dollars leaving the government and going to the going to all these providers and all these Medicare recipients and buying scooters and all the things that that kind of bothers me. But there's just so many things that are in the Medicare system that are just making it unsustainable.
What do you think is best for New Jersey seniors?
I think what's best for New Jersey seniors is for New Jersey to go ahead and implement the Affordable Care Act in a responsible way. I think that in addition to the savings that the Affordable Care Act generates, it also looks at ways to deliver care differently so that we're paying doctors based on outcomes versus how many tests they give or how many devices seniors have. But I think, you know, the real issue...
Does the voucher system, by the way, empower New Jersey seniors as well?
Well, empower them to pay more, yes. I think the
empower
choice
them to
here...
choose their own coverage? And would hospitals benefit in a way?
Well, so I don't think hospitals would benefit because you'd have less people going to get care. We know that when people have to pay more, less of them seek care, and then they end up having worse conditions down the line, which cost more to care for. I think that the bottom line is that there's a choice here. I mean, you have the Romney-Ryan plan on one hand, which wants to privatize Medicare, wants to essentially end it, end the way it is now, and rely on private insurance companies to make decisions for seniors. And then we have the president's plan, the Affordable Care Act, which asks seniors, it provides savings to Medicare and empowers seniors to make the choices in their own health care.
Critics also say, though, that that Ryan's plan would ultimately cost seniors more for health care. What do you think?
Well, again, $100,000 we're spending more per each senior than is taken in. It's way too much, and it's unsustainable, and we're handing that bill over to the future generations. So since that is unsustainable, the way that we could improve the program would be to have seniors care what things cost, to shop for a doctor, to get rid of the middleman in a lot of the scenarios and a lot of the interactions we have. You don't have to have a third party paying for every little thing. Instead, if you had a budget and you had your own money, you could get more with less.
If you're sick, do you really want to shop for a doctor, or do you just want to be able to find good health care?
We're not talking about people just in the hospital, but Medicare pays for a lot of things even outside the hospital. And people just come for visits, and there's no way that they are restrained. And the current Medicare system is truly unsustainable. It's not a free market-based system. I think that we could do a lot better with a lot less if we gave seniors choice. And what Ryan is proposing is that by 2023, and not until then, people would have a choice of staying with the current Medicare system or going to a system of the vouchers. And so I don't think that that is such an unreasonable idea.
Quick last word.
Well, I think that You bring up an interesting point as far as how the Ryan plan would affect some of our sickest seniors. Right now, Medicare, you have 21% of the beneficiaries have 5 or more chronic conditions, resulting in 2/3 of the total cost to the system. I don't think handing them a voucher check and telling them to go to a private insurance company is really a suitable solution to that problem.
Thank you both so very much for joining us. Next, more on election 2012, including empowering voters, how one local nonprofit is going on tour to make a difference in the community. When New Jersey Now continues. Stay tuned.